Here we are. Thank you, Simon, for the lovely introduction. So I think you're just hearing my voice at this point, or you can maybe already see me. My name is Katarina Reimer, and I lead the KLF Foundation. And I have today our wonderful guest from Central Health, one of our partners in this project, Dr. Diana Cook, with me. So what we are looking to do tonight is helping you to understand a little bit more why, if, and how you could participate in this program. And perhaps let me give you a little bit of background about the program and what the foundation does. So the KLF Foundation is really in the business of saving female lives, and we've done that across the last 9 years, across 3 different elements: awareness raising, prevention, and care and support. And so this project really falls into the main component of primary prevention. How do I prevent my child or my body to have a disease? And we will hear a little bit more from Dr. Diana Cook today on how easy it actually is. But if I can just focus you a little bit on that slide you currently see on the screen. We started at the foundation with the vaccination program, because in Hong Kong there was no universal HPV vaccination initially. So we went into public schools and provided the vaccine plus an educational component on a pro bono basis. Now, over the years, we made some inroads, and the government has established it as a universal vaccine to be recommended. And girls between 10 and 11, or we can maybe touch upon that a little bit later, Diana, are being given or are eligible for the government-funded program. Yet it leaves the older girls and the boys still at need. And this is really why we founded this private school program, where basically all of the partners which are involved, which is Central Health, then the KLF Foundation, MSD, Merck as the vaccine provider, as well as Immunis, which is a new vaccination portal, which adds a tech element to the program. And of course, as well as Harrow, we provide the services at pro bono basis, but the vaccine comes at a cost to you as the parent. However, much cheaper than it would be in the private sector or in the market out there. So we had this program running with the ISF Academy in Park Fulham in 2019, and then of course COVID hit. So it stopped, and we're now super excited to restarting this with Harrow, ISF, and other schools in Hong Kong. So welcome to you all out there, and perhaps, Diana, we can start kicking it off with the first question. And I guess as parents, you and yourself, myself, even so we have younger children, is always like the concern. Is it safe? What do I do to my child? Do I need to add it? You know, is my child really at risk? So tell us a little bit about HPV and how our children are at risk.
Well, HPV refers to a group of viruses, so there's more than 100 types of HPV. So you might have heard of types like HPV type 16 or HPV 18. And about 40 of these strains can infect the genital tract of men and women. It's important to note some strains can also infect the mouth and the throat. Now, HPV is very common, and about 90% of people will be exposed to at least one HPV strain at some point in their life. And it's generally passed on through sexual contact. So because it's so common, it's important that we're vaccinated.
But are all of them passed on through sexual contact? Because as far as I know, there are more than 150, 70, right? And some you literally just pick up on an escalator, and it passes. It's almost like a virus out there. But some are more serious.
Correct. And so definitely some kinds you can pick up, like the kinds that cause cutaneous warts of the skin. But the ones that we really care about in terms of cancers, like cervical cancer, are all transmitted through sexual contact.
Okay. And how many of those serious ones are there?
Yeah, so with the high-risk strains, there's probably 10 or 15 of those that we really care about in terms of cancer causing. And I guess that brings us to our next question, which is, can HPV, or how does HPV cause cancer? And so when we're talking about the HPV virus, we divide it into lower risk strains and higher risk strains. And so your lower risk strains like type 6 and 11 tends to cause non-malignant lesions like genital warts, whereas your higher risk strains like HPV type 16 and 18 put the person more at risk of developing a cancer. And so when most people get infected with HPV, their immune system often kicks in, and over 1 or 2 years they clear the virus. But up to 10% of people, their immune system has difficulty clearing the virus, and this leads to a persistent HPV infection. And when you get a persistent infection with one of the higher risk strains, this is what puts you at risk of developing a cancer. And the mechanism of this is that the virus gets into your cells, and over time, often many, many years, the virus causes changes which makes the cells become abnormal, then precancerous, and it can develop to a cancer. And it's important to note that with these viruses, mostly people don't have any symptoms, so they don't realize that this change is happening in their body, and it's only if they're having screening, like cervical cancer screening, that we pick it up. And unfortunately, sometimes we do pick it up too late when it's already developed into a cancer.
Which is, it's a nice segue for me to say the Caroline Foundation will also work across cervical cancer screening, trying to drive up screening rates. You know, one of our first projects there was also together with Central Health, with Dr. Lucy Lord. We pioneered this, providing basically free pap smears and now also HPV screening to low-income women. Now, I also coming just a little bit back to the high risk, because I think for the Asian ethnicities, there are some specific high risks, or is that a myth? Because, you know, as a parent, you always hear that, right? There's like, is it true? Is it a myth? Is it only 18 and 16, or is it for Asian versus Caucasian women, youngsters different?
I think there are some population differences, but in general, with cervical cancer, which is the cancer that is most commonly associated with HPV, so we know that around 90% of cervical cancers are directly related to HPV type 16 and 18. That's a risk for anyone who contracts that. Yeah. With some of the head and neck cancers, which are a little bit more common in the Asian population, that's where it becomes a little bit more sort of strain specific.
It's interesting. I mean, first of all, for me, when I started working for the foundation, I thought that HPV as a carcinogenic agent, and the uniqueness is really 97% of correlation is there with cervical cancer. I thought it's wow, right? Because you don't have that. Because then you see, okay, where does it come from? How do I protect myself against it? Now you mentioned head and neck cancer, which I know is a bit more prevalent in the male community, perhaps, or I don't know. But how do boys come into the, I mean, how do they play in? Why do we need to protect boys? Because ultimately the program also offers the vaccine to the gentlemen, to the younger gentlemen, right?
Well, we need to protect boys because HPV infection is incredibly common in both men and women. And so when we look at protecting boys, the vaccine is very effective at preventing genital warts, but it's also effective at preventing them from developing a persistent infection with any of those high-risk strains, which in men are more associated with penile, anal, and then head and neck cancers. So, good protection for boys for all of those things.
Yeah, and I guess talking a little bit about geographics, I mean, the experience I have had working for the foundation and advocating for our cause, it's obviously not an easy conversation. It's not a lunch or dinner conversation, yeah, and it would be much better if we had a drink here right now.
Indeed.
But so very often, and some of the studies we did back then with CUHK was, some of the parents said, well, why do I have to vaccinate my child so early? Right, because I think the earliest vaccination age is 9, and parents are, I think, rightfully kind of concerned, if I give this vaccination, maybe they started to have sex early. What do you hear as a practitioner, and why should we vaccinate at such young age?
Well, there's lots in that question. So actually, parents concern that children will start sexual activity younger if they're vaccinated for HPV. There are many studies that have shown that that makes no difference to the age of sexual debut, so that's important to note. We vaccinate adolescents young for a number of reasons. The biggest one is because of the way the vaccine works. So the vaccine is acts as a prevention for infection. It's not given to treat an existing infection. And we know that HPV is often transmitted with first sexual contact. And using Australian statistics, we would say for 15 to 19-year-olds, 80% of them are going to have some sexual contact. So what we want to do is get the vaccine in, give the body a chance to make antibodies and protect the person before that first sexual contact happens. Now, it's important to note that once somebody's already sexually active, it's still really good to vaccinate. And the reason for that is that it's unlikely that a person's been exposed to all the 9 strains of HPV from their sexual activity so far, and so there's still good benefit of having the vaccine. The second reason for vaccinating so young is that the immune system of younger adolescents responds better to the vaccine. And because of that, for younger adolescents, they only need 2 doses of the vaccine compared to vaccinating 15 plus and adults who need 3 doses of the vaccine to achieve the same immune response.
Interesting, and I think this was really great that you mentioned Australia. I mean, I think for the audience out there, Australia is really, for us in Asia Pacific, the gold standard of when it comes to cervical cancer prevention. Australia has a national program in place for I think female and male, right? Yeah. On the screening side, they are up there already with HPV testing. Pap smear is like for the old world, right? Yeah, this HPV testing. There's self-testing now being trialed. So Australia is definitely, and the Caroline Foundation is also part of the HPV coalition, where we're really looking at HPV-related diseases across the region. So it's quite interesting what Australia was able to do, and I guess you guys have down there now by 2030 you're looking to eradicate cervical cancer entirely through those government programs.
Yeah, so from the wide vaccination of all teens and catch-up vaccinations for older people, aiming by 2030 to almost eradicate cervical cancer, which is pretty amazing.
That's great, but then of course there's always a question as a mother. Is it safe? What's my baby gonna come home with after the first or second jab? Is it gonna be hives? Is it gonna be fever? What are we facing here?
So the vaccine's very, very safe and very well tolerated. And we're benefiting from the fact that so many doses have been given. So more than 200 million doses have been given worldwide, and the vaccine is recommended for teens in more than 80 countries. So the vaccine data has been reviewed by the WHO and many other international health authorities, and they haven't come up with any concerns or any serious adverse events from the vaccination. And if we think about the way the vaccine works, the vaccine contains virus-like particles. It doesn't contain live virus. So, when injected, it's not going to replicate, it doesn't cause infection, and it doesn't cause cellular damage. And so that's why the vaccine's really safe. In terms of side effects, the most common side effect is a vaccine site reaction, which means a little bit of redness, pain and tenderness in the site. But that generally resolves very quickly, and so very well tolerated and very safe. And importantly, very effective.
Great. Well, before we go a little bit more into how the vaccine would be administered with the Harrow cohort, but as I said, we will also be doing this with other schools. It depends on the age. I also want to explain a little bit really why the Caroline Foundation has kind of come up with this project. For us, we also see the power of your children to help us spread the word, right? So all of the schools are given a little bit of a catalog of what they can do with the students in terms of health knowledge, health prevention, having little workshops where the kids basically come up with a post or something, spread that on social media, etc. Because we are a small charity, yet it is still a very, very big problem. Now, you just said 2 million doses
have been given? 200 million.
200 million, good. Because 2 million would have been very, very small. 200 million, but this globally. Yeah. But there's still, I think, quite a bit of work to do, right? So now perhaps it's a time to just say, so how does it all mechanically work, right? So how many vaccines does my child need? What are the intervals? We have a slide to that, I believe, right?
So it depends a little bit on what age you're starting to vaccinate. So as I mentioned, younger immune systems respond more favourably and require less doses of the vaccine. So if your child's aged between 9 and 14, they need 2 doses of the vaccine approximately 6 months apart. If your child's 15 and above, they require 3 doses, and we space them at 0, 2 and 6 months for the vaccine.
Right. So, I mean, I think for the purpose of tonight, for the Harrow parents, we are offering, the program is offered to 9 to 14-year-old children. So the vaccinations would happen on campus, which are supported by Central Health's doctors and nurses. MSD, Merck is the provider of Gardasil 9. Perhaps, Diana, I can invite you to talk a little bit about how the vaccine has developed, because when I started with KLF, we still had the GSK vaccine, which was the quadrivalent. I mean, perhaps we can talk a little bit about the vaccine itself, and then parents, I would like to now start inviting you to put some of your question onto the chat. Our research assistant Sherry here in the background will feed that through to us. And then we also have, after Diana's answering that question around the Gardasil vaccine, Emma Holcroft, who is the co-founder of Immunis, on the line, who will say a few words, but we're coming to that in a minute. So back to you about Gardasil and how the vaccine over the last 10 years has developed, and what advantages there are now.
So originally we had sort of the 2 earlier vaccines were Cervarix and Gardasil 4.
Yeah.
And so Cervarix, I believe, only had type 16 and 18, and the Gardasil 4 had four types. The Gardasil 9 now contains 9 strains, so it's got the 2 most common, so type 6 and 11, which cause genital warts, and it also has good cover for type 16 and 18, which are the 2 that are most associated with cervical cancer. But it has 5 additional strains in there that are higher risk strains and associated with all kinds of cervical, vaginal, penile, anal, and head and neck cancers. So you're getting better coverage for more strains with the latest vaccine, and important that the safety data is the same and the efficacy is the same. So very, very effective at preventing infection with these strains.
And I believe also, in case now my girl would have had already one vaccine and missed it, right? So because some vaccines is very important, you have the temps in between, correct, right? 2 months, 3 months, 6 months. With the HPV vaccine, we don't have that problem, right?
No. I mean, ideally you would follow the vaccination schedule, but if for some reason you can't have your vaccine on time, there's no maximum interval. So if you've had your first dose, it's always worth having your second dose. And I think it's important to also note that in terms of how long the vaccine lasts for, because the vaccines were so, are reasonably recent, so Gardasil was licensed in Australia in 2007 and in the US in 2009. Our follow-up studies on how people maintain antibodies are still very much ongoing. So, we have data from 5 and 10 years that show that people still have very good antibody levels and very good protection, but we don't know what happens after 20 or 30 years. We're still working on that. But at this stage, booster vaccinations are not recommended.
Okay. So, that's my first question, and then we pop maybe over to Emma first. So if you were in the first cohort, let's say in Australia, back then when they introduced it in 2009, they introduced it in Australia, I believe.
2007.
2007. So if you had it there, so the longevity of it is 15 to 20 years. What would you as a practitioner now recommend to that woman who probably is married? Is it just a regular screening, or is it to get another course?
So, it depends a little bit on somebody's personal factors. So if they're not going to be having a lot of new sexual partners, I would say just probably regular cervical screening. If you had an individual who was having many new sexual partners, it might be worth having a vaccination with the Gardasil 9, but just for that extra.
Because you could also have that vaccine until 45, the age of 45, right? That's what it's licensed.
So licensed to 45. There are cases actually when we will give it to people older than 45 if we feel that their lifestyle will benefit from it.
Oh, okay. All right. Okay, great. Well, thank you so much for now. Please make sure you're putting your questions on the chat. I can see there are questions coming in. Now, let's Is Emma ready? So I would like to introduce our new project partner, which is Immunis, and the founder, or one of the co-founders, Emma Holcroft. She's joining us today, I believe, from KLF, Malaysia. Yeah, KL. It's good that everyone is traveling again. And Emma is going to give us hopefully a nice overview on how we're trying to also keep up with the times and make this easier for you as parents, right? Because my two kids constantly come home with something little from the flu jab they receive at school, and then I need to pin it to something, and then I need to collect it, and then I need to bring it to Central Health, right? So Emma, tell us how Immunis, for the participants of this project, can make all of that life much easier.
Hi, everybody. Thank you so much for the introduction there. I'm Emma Holcroft. I'm a co-founder of Immunis, alongside Lucy Lord, who runs Central Health Practice. And we, a couple of years ago now, founded Immunis, and it's essentially a digital vaccine record. We're calling it Immune Health because we will, over time, bring in the tests associated with vaccine preventable disease as well. But at the moment, we're starting with vaccine records. So we are, let's give you a little back here. It's a digital vaccine record. It's interoperable so that it can be taken between different health providers. And it's also focusing on digitizing the schedules associated with vaccination. So that would be which age ranges, how many doses, which products are available, etc. So all of that information is brought together. And because we do that, we can give patients a personal status. So we can take the records into the app and interpret them in terms of whether the patient is due a dose, has completed their course, and they then got that with them through life. And when those schedules change, which does happen increasingly, we can alert them as that recommendation changes, rather than waiting potentially for a doctor to tell a patient, which can take a long time because they often don't have the full record history or the system's capability to get that information to patients. So we bring together digital best practice. We have a team of people who've worked across healthcare and also digital banking, so quite sort of advanced in the technical thinking. And we also bring together a team of international doctors with knowledge across all areas of vaccination and across many different countries as well. And so that really is bringing together the key information needed. And importantly, part of our team, the idea came from the patient perspective. So we are very much representing patients, hence the interoperability, rather than individual doctors or individual providers. So the platform itself is trusted source vaccine records. So at the moment, they will come from a medical provider, in this case, Central Health, or you can also scan in your QR code vaccination records from Hong Kong, the EU and the NHS. It's designed to be interoperable. So while we're working currently with Central Health, we're talking to other doctors across Hong Kong about joining the platform. So the idea really, the vision for this is that every vaccine record is recorded digitally one time, and then it is shared digitally rather than being rekeyed or retrieved, or when it's lost, rekeyed between schools, between documents, etc. It should have one digital entry, and that's really then shared digitally throughout its life. It's for that reason it's interoperable. As I mentioned just now, digital schedules, and that's really because even if we just take HPV, when the early vaccines were rolled out, there was a 3-dose schedule for all the vaccinations. And then as more and more data has been gathered over the real world through the rollout, it's become clear, as Katerina mentioned, that younger children have better immune responses, and therefore we can drop that down to a 2-dose schedule. If we look at places like the UK, they're currently rolling out a 2-dose schedule to everybody because they've got sufficient data and actually probably sufficient coverage of the vaccine such that they can start to address the schedule. The point being, the schedules change, and you know, if you keep those on paper, that's obviously not a dynamic mechanism through which to keep them. So we will change those schedules throughout life and keep you up to date as a user with what that means for future doses. We give you a personal status. I'll demonstrate that in a moment. It's very much patient controlled. So this is very much up to you as parents, as patients, A, whether you want to come on the platform or not, and B, if you want to share and keep sharing your information. So we've developed this really with a patient mindset. It's meant to be something that patient controls and takes on their health journey as they go through life with a specific focus on vaccination. And as part of that, we can give you some patient-friendly health information. So if a status changes, if a schedule changes, we can explain a bit more about why. And in today's world, that information can take a very long time to get to a patient from the source, just because it has to come through a doctor, and you may not go to the doctor all the time to get that information. So by providing this to you on a digital platform, we can alert you very much as it happens. And with this, we aim to collaborate on similar goals to Karen Lung Foundation. We want to reduce vaccine preventable disease, which and the burden. So reducing both under and over vaccination, because we know both apply, and make vaccine adherence, so right vaccine at the right time, easier for people to work with. And in doing so, we also want to reduce the cost to health services around the world of delivering vaccines, because that adherence and communication is quite an expensive part of healthcare delivery, and one which we can probably improve on by digitising. A little bit about how it will work. So you, as I mentioned just now, have a choice. You don't have to sign up to the programme as part of this process, but if you'd like to, you need to provide some information through the forms, which I think will be distributed to you. We need to collect some information about you as a parent, and that's so that we can be sure we're releasing the right information to you for your child, so the release of the correct medical records. That will be name, date of birth, email address, gender, and relationship to the child. And for the child, we will need full name, date of birth, and gender. Most of that data is either for identification purposes, so making sure we release the right data, or for providing you with the right vaccination recommendations. As you'll imagine, gender and age are both very important for that. So that information will come in if you're keen to sign up. It will go to Central Health. They will register you in their system, and that will automatically register you with Immunis. And we will then, you will then receive an invitation through email to complete a security process. So making sure that, again, we've got the right records going to the right patient. That can be done before the vaccination event. Then on the day of vaccination, the doctor will administer vaccine to your child. And either on that day, possibly the day after, depending on the timing of which the records get recorded, the information will be put back into Central Health's medical system. So the date and the product that was used for vaccination, and that will be sent straight through to the app for you, for your child. So you don't need to do anything once you're signed up, it will come straight through to you. And then you have an optional step here. We have a policy where we invite one parent to be sort of the designated parent to receive the information from the healthcare provider. But you as a parent can choose to share that with a trusted person, whether it's another partner or a carer for your children, so that multiple people have that information as and when it's needed. And you can stop the sharing at any time as well. So a little bit of an overview of how it will work. So I hope you can see this, because I know it's probably a small screen for some people, but you can either view your list of vaccinations by time, and if you expand on that, you will see the type of vaccinations, so in this case, HPV, the date it was given on, who was the provider and who was the certifier. So sometimes you can take a paper record to Central Health as an example, and they may not be the provider, but they would be the certifier of the record. It will tell you which product you had, who the manufacturer is, and which disease it protects against. And they will all be provided. So on here, you can capture every vaccination records for every vaccine that's there. And if you want to, you can then create a PDF record of that as well, so that you can either email or print that record depending on the need. You can also, whether you're a patient of Central Health or not, you can also use this for COVID records, and that will be COVID records emanating from the UK via the NHS, Hong Kong or EU certified, only those that have a QR code associated with them. But we have a function to scan those and digitally interpret them, so you can keep that on the phone. And give you a little view on the right side here of how the smart record works. So we will look at your age, and the little green circles there will show which of the recommended doses you've taken. So it will show you quite clearly if you're due a dose, you will see a red circle here to show that you're eligible, but you're missing a dose. And we give you a lot of information below about the schedule, how flexible that schedule is, and more information about the disease as well. And just a little snippet of some of the other information that you can glean from this. So again, if you are already a patient with Central Health and you have your vaccine records there, when you are onboarded, you will receive more vaccine records than just HPV. You will receive everything that's digitized with Central Health. But some of the information we can give you there is, if we take things like the measles vaccine, we found patients who've been given historically the first dose of measles under 12 months of age. And while it's safe to do that between 6 and 12 months, many jurisdictions don't accept it as part of full vaccination. Similarly to the HPV age boundary, it's not as effective on children under 12 months of age. So we will show you that in your app so that you have the choice of taking further vaccination. You've got that information essentially interpreted from your records and presented out to you. So there's a collection of different things in there. And if you are a patient of Central Health, you will get that info through. If you're not, we can look at also adding additional records to your history with Central Health, and you can keep your whole record on the app. And so our mission, we're working with a number of doctors at the moment, and also a number of insurance companies, to try and make vaccine record keeping easier and more effective for families, so that hopefully our children will go through life with a digital record and not carrying a small book of paper around like many of us parents have had to do for them. And very happy to answer any more questions you might have as part of the Q&A. So thanks very much for your time.
Thank you, Emma, for your contribution. And I certainly do have a couple of questions after your presentation. Now, Sherry, do we have any questions on the line already? A couple, yes, I see a couple are coming in. But let me get started. Now, it's obviously, since you mentioned Central Health, and it's just for everyone, really, this is how our work comes together at the Caroline Foundation. It's really always someone calls me and says, oh, hey, there's this. And so Lucy called me and introduced me to Emma. And then I said to Lucy, oh, why don't we start this program again? And so it really takes a village to do good. And it also takes a village to make sure our kids are healthy. Now, I guess many of the parents may ask here, well, what happens if I'm not with Central Health? Can I still opt in?
Yes, you can, very much so. So the process, the first step that we mentioned just now, I think everybody should provide that information if they want to be on board, whether they're a current patient or not. But Central Health administrators will see straight away whether somebody's an existing patient. So if they are, we don't need to onboard. That will just allow us to click and send through. If they're not, they can be registered, and that information we've requested there is the basic information for Central Health registration. So you'd be effectively registering as a new Central Health patient as well as an Immunis onboarding party.
Fantastic. Okay. And Diana, for you as a medical professional, an innovation such as Immunis, how does that help you with your work?
Well, I think it's a big time saver for one. I have so many people come with 3 vaccination books and they've had their vaccines done in 3 different countries and they're in different languages and we've got no idea. It's very time consuming, and it's also very hard to go back and say, well, was this 2, 4 and 6 months, and have you checked all the boxes that you needed for the vaccine? So if we had it in a clear format, I think it would stop vaccination errors and repeat vaccinations, and also show us clearly where there's gaps and where we need to do some catch-up vaccines.
Great. So I've got one question here. We had from the line. How does it actually work? What are the cost involved? Yes, as much as Simon said, you guys will get the info available out there, and it will all be online. So again, we're trying to keep up with the tech. Yeah, we are running tomorrow actually our annual lunch, which is all around health tech and med tech, and unfortunately Emma can't be there. Diana is joining us. No, I mean, so really do consider signing up. The charity and all of the other partners are providing this pretty much at pro bono services. Yeah, there's a small administrative cost, but the vaccine is also provided by Merck at cost. Unfortunately, vaccine costs have gone up, skyrocketed. and I think that, I don't know, and this might be a question for you after I'm saying this, but yeah, the 2-dose schedule is at 2,500, and if there was a 3-dose schedule, depending on the schools, if you have children over 14, it's 3,700. And then obviously, from my perspective, we always say there are also underprivileged children out there. We also offer you the option to opt in for more, because that will come back as a donation to the charity. But since we were talking a little bit about health tech, med tech, and these vaccine schedules, how many kind of slip-ups do you kind of get, like where people go like, oh, I don't know anymore. How far behind are we? Are we advanced? Are we beyond? You encounter that a lot, and or is it for you also that you actually, as a practitioner, need to educate the parents about vaccines such as the HPV vaccine, because it's kind of probably not on the measles radar or on the chickenpox radar level?
I think increasingly HPV is becoming a recommended vaccine. As we said, more than 80 countries have it as a recommendation for their teens. So I think that's becoming less of an issue. I think there still is a need for education, because people think it's, because of the sexual element to it, and there's concerns about, children being sexually active earlier. And I think there's a lot of education to be done about how this vaccine works and why at that age and what it's preventing. But in terms of vaccines in general, I think particularly in Hong Kong, because it's a population that's come from all over the world, and every country has a slightly different vaccine schedule. So if you start in one country, then come to Hong Kong and then move somewhere else, it can be very difficult to make sure that you've met the vaccine requirements for each of those countries, because often the schedules are a little bit different. So,
so on a platform like Immunis, very will work very brilliantly for this international crowd we're hopefully having on the line. So we sign off here today, and thank you, Simon and the Harrow team, for helping us out with this. So if you may, please scan this QR code. I know our research associate will be very happy if we get some feedback on if this has helped you to make the right decision whether your child should be vaccinated or not through this HPV vaccination and educational program led by the KLF Foundation. So thank you everyone for today. Thank you, Diana.
Pleasure.
Okay, thank you. Okay, good night.
Good night.